The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with another edition of The Genuine Article. And I'm pleased to be talking with Carl Pepin, who's just edited for us a magnificent supplement on insulin, its role in coronary artery disease, and its potential role as a therapeutic agent. Welcome, Carl. Why don't you review for us a little bit the topics that are included in this supplement?
Well, Tony, we have assembled a group of 6 articles which I believe cover the topic in this area as well as anything in our field. The first part of the supplement begins with a summary of the work done by Heinrich Schelbert on the effect of insulin-resistant states on the coronary circulation. And this work is pivotal to understanding how these states set the stage for the development of coronary vascular disease.
Yeah, I think there's another wonderful basic mechanistic paper there by Dr. Dandona and Associates.
You're correct. Dr. Dandona and his colleagues deal with the anti-inflammatory and anti-atherosclerotic aspects of insulin and actually summarize a lot of their own original work in this field. It's truly an outstanding contribution, and I think anybody who's interested in this field needs to make this part of their required reading.
Tell us, what are some of the other articles?
Well, another article deals with the importance of glucose and glucose lowering in the setting of an acute coronary syndrome. It's recognized that perhaps almost half of the patients that we see with acute coronary syndromes have hyperglycemia. And for the patient who previously did not carry a diagnosis of diabetes, hyperglycemia at the time of an acute coronary syndrome is really associated with a very high risk for adverse outcomes. We also have a thorough review of the treatment of patients with this syndrome.
Yeah, it's one of those things as clinicians we've recognized for a long time that hyperglycemia often occurs in the setting of ACS, and I think the focus now clearly is on how aggressively we ought to be treating that. Does the supplement address that?
The supplement does. The supplement talks about a number of the intravenous insulin protocols that are available. It doesn't favor one or the other, but at least it presents them, I think, in a fair manner for our readers. And then the supplement also deals with the longer-term management of glycemia in diabetic patients, reviewing some of the newer agents and the newer combinations that are available for clinicians.
Well, you know, the recent ACCORD study has really created a buzz suggesting that tight glycemic control may not be as valuable as we thought it was in the patient with chronic diabetes. Do you have any sense about that? Is that taken up in the supplement?
Well, another article deals with the importance of glucose and glucose lowering in the setting of an acute coronary syndrome. It's recognized that perhaps almost half of the patients that we see with acute coronary syndromes have hyperglycemia. And for the patient who previously did not carry a diagnosis of diabetes, hyperglycemia at the time of an acute coronary syndrome is really associated with a very high risk for adverse outcomes.
Yeah, particularly. The article by Jorge Plutsky and his colleagues on microvascular and macrovascular disease and diabetes I thought was particularly interesting.
I agree. Jorge and his group, particularly Dr. Orosano, who senior authored this paper with Jorge, have made major contributions, and in this article in the supplement they have tied together the notion of microvascular disease with macrovascular disease. As you probably know, most of the trials with treating glycemia have really shown reductions in microvascular events, with modest impact, if any, in macrovascular events like acute MI and death. Yet Jorge and his colleagues do a masterful job of explaining that and tying the two vascular components together.
It really is a wonderful supplement. We're so pleased to have it in JACC, and thanks so much, Carl, for preparing this for us.
Well, thank you, Dr. DiMaria. I'm delighted to have had this opportunity for JACC and for the college.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.